releasing the trapezius with the client prone. The trapezius is the most superficial of the back muscles. So anytime I'm going to do any work in the back, I really want to do some trapezius work first. If I'm working through erectors, if I'm working in the rhomboids, if I'm working posterior cervicals, the trapezius lays over all of those tissues. So it's quite beneficial to release, warm up, and give some nice attention to the trapezius before working in those other tissues. And since our client just turned over, we want to encourage them to take a few long, deep breaths. Maybe sighing to exhale. These are the kinds of things to notice. How do they land? Like my friend Jennifer here, this left shoulder is just resting a little bit higher than the right. That might be a normal thing for her. Maybe her pelvis tilts a little bit. Maybe she tends to lean her head over to the left side so that when she gets on the table and the head centered, the left shoulder rises toward her left ear. So many. So we're just noticing how they land. And then starting with some oil, some nice glides. At first, just trying to get the oil just spread evenly. Notice my body mechanics as I do this. My table is low enough, and it could be even lower. I could drop this table down even lower so it's just above my knees, so I can get my whole body over the pressure of my hands in her low back, in those glutes at the very top of her pelvis, gliding along the erectors and the trapezius there. Notice that my pelvis follows my work. Notice in my body mechanics that my feet are close together and both of my knees are bent. I do not get stuck in the warrior stance. If I'm stuck in the warrior stance, I don't have very far to go. Then I'm just pushing with my hands as opposed to sinking and pushing that back foot, straightening that back leg. It feels different to the client when you're sinking your body weight and not pushing into their body. It's also key to telling you how much pressure to use. When I start sinking my body weight and I can feel the tissue give back, then I know that that's the right pressure. If I have the table up way too high and I'm just pushing and using my arm strength, number one, I'm going to obliterate my shoulders, but I'm also not going to be able to feel her body's resistance to me because I'm always pushing. So play with having the table a little lower. And then as I'm going to focus on the shoulders, I'm going to bring this table up a little bit. Gliding down those lats on the side. Back flap of the armpit. Teres major, latissimus. On the shoulder blades, infraspinatus. Teres minor and that lateral edge. gliding down trapezius and those erector bundles and the rotatories and multifidus underneath the erectors. Gliding across the top. What I notice is that that left shoulder wants to creep back up. So that's something I'm going to pay attention to. And I can feel her levator scapula here on this left side. It's definitely thicker. I can feel that her traps on this side are thicker through here. So there's some sort of pattern where she's really rising that left shoulder up toward the left ear. So what we're doing is just a general warm-up of awesomeness in the upper body to prepare the upper body tissues for the more specific work, or just to give ridiculously awesome massage. We can just do these things over and over again. So I'm going to do what one of my clients lovingly calls the massage washing machine. And we start with gliding one hand down while the other pulls up the side. Across the top of the shoulder with one, sliding up. Lats on this one, then this one goes down. This one slides across. And now we can do that with the hands. And then I also really like to do it with the elbows. And sliding the forearms, it depends on your client. You get some nice oil on your forearms. Now this side, because her left shoulder wants to lift up, it's going to be a little trickier for me to get that arm under there. But see how low my shoulder, my elbow has to drop so that I can glide up in between her shoulder blade and her spine. And then we drop the other one in there. And then we just go side to side. Drop that elbow way down, glide up using the ulna. And just the edge of that lateral forearm, the ulna bone. How's that feeling, Jennifer?
It feels great.
It feels great, she said. Awesome. Now, if you have someone who has, if their shoulders are really lifted, if they don't have much neck space for you to work with, and you can't get your arm in there, you could switch to just doing this little TP glide, little prayer hands glide. We're just using the pinky side of the hands to glide up. All right, so that is just a wonderful general warm-up before we begin our more specific upper body work. Let's do a little bit also actually in the back of the neck. Great. And that's our upper body warm-up.